So welcome back. Today we'll be talking about the importance of attitude in stroke recovery. In 1979, there started to be some studies focusing on if a patient's attitude actually helped them beat their disease and if it had any long-term effects. And it turned out that those patients who had a positive attitude and who had what is called a fighting spirit not only beat their disease, but then they tended to live longer and live better. Now, the early studies were mostly done in cancer patients, but over time they were also done in other parts of medicine, specifically in patients who had survived strokes. And what was important about these studies is that the findings were statistically significant. That means that these were not flukes, they were not random, they were not errors that happened and that's why it looked like these patients were doing this, so that's why this attitude was helping. It wasn't like that. The other thing is that these findings held true even if other things were adjusted, meaning that if you looked at the data and you took out a patient's gender or how educated they were or how much income they had, it still held true. And the phrase for this attitude was called medical optimism. Now, when it comes to medical optimism in stroke patients, it actually was much more beneficial to them than was first realized, because stroke patients then, instead of saying, I have to do this, they would change their mindset to, I get to do this. I get to take these medications. I get to do these exercises. I get to eat healthy, etc., because it would help them live longer and better and recover faster. And it also helped a lot with that lifelong struggle of trying to hide the deficits that they had during their stroke. And especially if you look at patients with optimism, there are some that are just kind of seem like they're born that way, right? You see people that always see the glass as half full. And whether that comes from their upbringing, their beliefs, their family, their friends, we really don't know. But the good thing is optimism can be learned. But like anything, it is hard to maintain. So it's kind of like learning a new language. You have to use that skill everywhere, every day, and keep practicing and keep working at it. As for myself, I adopted this attitude of optimism about a few days after my stroke. Like that first week was very rough for me because I had a lot of complications. I needed surgery. I was in pain. And truth be told, I was depressed because one day I'm a doctor in clinic and I am seeing patients, and the next day I'm a patient myself and I'm in a bed and I'm fully dependent on everybody else for everything. And so I had to learn how to walk again, to talk again, to eat without choking again, etc. And I did those things, but I remember one day when I learned I could no longer write legibly again. And for someone who got a prize in 5th grade for their writing, for someone whose patients always said, wow, you do not write like a doctor, is very neat, this had almost become a part of my identity. And so when I realized this was something that would not be that true going forward, it actually really crushed me and I was upset by it. And there was a physical therapist that day by the name of Tim. And as he was rolling me into the rehab activity room, he saw I was upset. And as we're going in, he says, do you see that lady over there? And I looked over and there was a female patient and she was writing very neatly, something, a letter or something like that. And I nodded yes. And he said, that lady can write beautifully. And then he paused. And in that pause, I saw red. I said, well, thanks a lot, Tim, on the inside to myself. I'm like, thanks a lot, Tim. Way to make a gal feel great again. Please tell me another. And then after a few seconds, he said, but she can never walk again. And that is the exact moment when everything switched for me, when I became grateful and I became optimistic. And I used those skills along with the skills that I had as a doctor to help me problem solve and recover from this stroke. And it is one of the big reasons why I am here today. Now, I will say that medical optimism is much more effective when it is not one-sided. because when I would go to the rehab doctors or the physical therapist, they would always kind of end the visit with like, oh, you're doing great, or you've come so far, we'll help you get through this, etc. But when I would go to my other doctors, who shall remain nameless, they would read what had happened to me in the hospital stays, and as they read, their face would get more sad and gloomy, etc. And they would look at me with pity and say, wow, you almost died. And I would be like, yeah, I was there for like, all of that. So yeah, I know. And then the rest of the visit, they would kind of focus on things that I didn't do. Like, oh, you haven't done this yet. You haven't done this yet. You have to do this. You have to do that. And I remember thinking, you just basically called me a medical miracle. I mean, don't I get points for that, at least? But anywho, going through this experience really taught me that as a doctor myself, when I have patients in clinic, I try to make a point to end the visit with optimism. And I try to say things like, you are doing good, you're doing great, we will get there, don't worry, we'll work through this together, etc. Because I learned that when your doctor says you're doing great, guess what happens? You're doing great. Your whole day goes great. Your whole week goes great. Until you see them again, it might be going great. And it makes you want to be a better patient. So for me anyway, I think that optimism in medical recovery is priceless. As the Roman philosopher Seneca would say, the wish for healing has always been half of health. Until next time.